Hello, I'm Shrantla Holochak, the founder and CEO of UMA, an Ayurvedic beauty and wellness collection. This is the UMA Elements podcast. Each week, I'll be having a conversation with someone I greatly admire on the topics of Ayurveda, holistic healing, spiritual well-being, and alternative health. By sharing wisdom, together we will unlock a secret that, as ancient as they are, Ayurveda and other ancient modalities are as modern and relevant today as ever. Our guest today on the podcast is Dr. Zeel Gandhi. Dr. Zeel, an experienced Ayurvedic physician, has dedicated over a decade to the treatment of patients. Beginning her career in France, she specialized in metabolic and musculoskeletal disorders. Throughout her journey, she has held esteemed positions at renowned Ayurvedic institutions worldwide and has also served as the head of R&D for a celebrated Indian Ayurvedic hair care brand. With a wealth of experience, she has acquired comprehensive knowledge of Panchakarma, internal medicine, and Ayurvedic formulations. In this podcast, she enlightens us on the application of the Ayurvedic science in managing hormonal, skin, and hair concerns. Hi, Dr. Zeel. Such a pleasure to have you on the podcast. I really enjoyed chatting with you recently, including at the event we did with the editors. And I'm excited to dig in more into your expertise and all the lovely insight and recommendations you have to share. So welcome.
Thank you, Shrinkla. Thank you for having me. It's always a pleasure to talk to you. And it's always nice to talk about Ayurveda as well.
Amazing. And Dr. Zeel, to dive right in, I would love your perspective as such a seasoned expert of Ayurveda and a doctor who's seen thousands of patients over a decade. What, in your mind, are some of the conditions that Ayurveda particularly shines in, especially when compared to traditional Western medicine? You know, some of the things that Ayurveda most helpfully addresses where some other treatment approaches may have failed.
So Ayurveda, well, it has 8 parts, and it would surprise a lot of people, but it also includes surgery, pediatrics, all sort of medical fields that we now explore. So even geriatrics. So it's Ashtanga Ayurveda, 8 parts of Ayurveda. I believe that the modern science has advanced leaps and bounds in terms of surgery and antibiotic treatment. But I truly believe the pure Ayurvedic potential lies with diseases which basically concern your metabolic system, meaning your hormonal system, your digestive system, and all kinds of chronic problems. I think with Ayurvedic guidance, lifestyle, and therapies especially the detoxification therapies are the highlight of Ayurveda, Panchakarma. I think when you have problems, let's say like irritable bowel syndrome, or when you have problems like polycystic ovaries, or not just that, it could be a simple problem of insomnia, but I know the way patients suffer because of it, or it could be just, let's say, erectile dysfunction because of chronic dyslipidemia. I think such problems are very well treated in Ayurveda, especially via Panchakarma treatments.
That makes so much sense. And I think there's also a lot of anxiety people have around these topics because they know they've been notoriously trying to deal with, in just a traditional Western medicine mindset. So it is encouraging to know that Ayurveda does have some promising clues in these areas. And you touched on Panchakarma, comes up a lot. And we also know that Panchakarma is a little bit of a commitment. Tell me a little bit more about Panchakarma as you view it. When is it time to actually go down the Panchakarma route, and what are some of the ways to make sure your Panchakarma is successful?
Right. So, Panchakarma comprises of 5 treatments. The first one is Vaman, where you undergo emesis when you have excessive kapha. Now, kapha disorders, especially if you suffer from asthma or let's say allergies, any congestive disorders, or even obesity for that matter, I think Vaman gives excellent results in these problems. Also, it's not necessary that you do these panchakarma treatment only when you are suffering from, let's say, some diseases. Ayurveda believes that even naturally throughout the year, because of the change of seasons, you experience a disequilibrium of doshas. So let's say when it is spring season, we all know that during spring season, the allergies are on a high, immunity is lowered, breathing problems, asthma, skin diseases are very commonly seen during the spring season. So that is the time when Ayurveda recommends, in spite of you being healthy, if you undergo Panchakarma treatment regularly at certain times. So I'm coming to Vamana now. So talking about Vamana in spring season. So if you undergo Vamana in spring season, chances are you may have a healthy body weight. You may not have cough, cold, infections, flu, etc. For the rest of the years, your allergies may, the bouts of allergies, even if you're allergic to something, the intensity of the attack would tremendously go down. So then the next treatment is Virechana. Virechana is for Pitta, the fiery element in your body. This Panchakarma is recommended in the autumn season. Uh, During autumn, although the temperature starts to cool down, but we know the heat the heat is being collected in your body throughout the summer, and autumn is the time when your pitta is on the highest, and that is when you may suffer from problems of blood. Like in India, I think, although we do believe that blood disorders like malaria are mosquito. I mean, it's spread by a vector, the Aedes aegypti mosquito spreading dengue, or the Anopheles mosquito spreading the malaria. But we in Ayurveda also believe that in spite of these parasites, if you're strong, you can resist it. But your natural immunity, your blood immunity, goes down during the autumn season. And it is commonly observed that during this season, blood related problems are on a rise. So we recommend either bloodletting during this season or virechana during the autumn season to keep your pitta down. The third, vata, is high during this season, this exact season that we are sitting in right now. In Ayurveda, this is prevalent. In the Indian subcontinent, we experience rainy season, monsoon season. But in the rest of the world, let's say, Shankar, you're in North America right now. Here also, the peak of summer causes dryness in the body and pains, digestive troubles, and hair fall. All kinds of vata problems are on a rise during this season. So in spite of you being healthy otherwise, to prevent these problems also, you can undergo a treatment called Basti Karma, which is enema. It's a series of enema, oil, and decoction enema given in a series alternatingly. And this is excellent to balance your vata in the colon. So these four Raktamoksha, we've already talked about it. Bloodletting in autumn season again for Pitta. And the fifth one is Nasya. Now, Ayurveda recommends instilling drops of ghee or oil in your nostril every day, 2 drops of it. But let's say if you're suffering from problems like sinusitis, or you have migraines, or you have general debility of your sense organs, meaning you feel that your eyesight is chronically, getting weaker, or you have some retinal problems, vertigo. For all these troubles, especially concerning above your shoulders in your head region, even for hair fall and acne, The Nasta treatment is excellent. And that can be taken anytime throughout the year. Um, uh, there is no seasonal dependence for this particular Panchakarma. But Vaman, emesis, Virechan, purgation, and Basti, I think these are best done during the season when your natural state of these doshas are high. Panchakarma, like you said, Shrankala, is a very involved process. You have to have a very specific diet during this entire process. You have to take care that you're not eating anything that would disturb the acting of the drugs, because these drugs are strong. They are actually, detoxifying the things, and you do not want this process to get interfered with. Um, Thus, we recommend this to be done in a good institution under good care and with proper dietary and lifestyle guidance.
Dr. Zeel, this has been mind blowing hearing you say these things, and I have so many follow up questions. Even as someone who knows Ayurveda, I like to think, well, what's been interesting to hear is your framing of the various processes within the Panchakarma as necessary based on the seasonality. So the first question I suppose I have is, does each Panchakarma session does not involve all 5 of the karmas?
No, it generally starts with Snehan and Spedan, meaning we get the doshas from your periphery to your koshtha. So we start with something called as Snehapan, meaning we give you ghee.
Mm-hmm.
And it's a very high amount of medicated ghee, which helps you collect all the doshas that has been, they have been spreading all through your body, get them to your gut, and then push them out of your system with the medicine. So for the first 3, 5, or 7 days, we prepare your body for this. The Panchkarma is done after, external Abhyangam also.
Mm-hmm.
Once this Panchkarma is done, then comes the part where we help you restore your health again. Detoxification is a very taxing process on your body. So with proper dietary guidelines and with proper medicines, we help you restore harmony of your doshas. So you get back to functioning normally as you were before.
That makes sense. The process of Rasayana totally makes sense. Dr. Zeel, now breaking down your guidelines around Panchakarma and actually doing it under proper care. I cannot underscore this enough. Even though I haven't undergone a Panchakarma myself, I do know it's very, very vitally important to do it in the right environment. For many of our listeners and people I often interact with, sometimes a full Panchakarma at a reputed facility isn't really an optional, especially something that feels seasonal, as you underscored. So in the absence of that, what are some of the recommendations you might have that might mirror the natural detoxification that the body needs around seasonal changes? And when one is ready to do a Panchakarma, what should one prepare for in terms of, is it a 3-week process? How can you make the best of the process? Tell us about both things, please.
Okay. So coming back to the first part of the question, where you do not have the liberty to undergo an extensive Panchakarma process, how can you manage your doshas in different seasons? So coming with Kapha first, Vamana, in spring season. So let's say, yes, emesis is a very, very tricky process. Purgation is perhaps easier because it's with the natural flow of the body. For emesis, let's say if you're not ready for a full-blown emesis or you do not have the time to do it, There is a process called Nishtivan in Ayurveda, where you hold certain drugs at the end of your mouth, near your throat, and let all the secretions, in fact, in these medicines that are helped, these medicines help you salivate, get all the secretions into your throat, and then you can simply spit it out. This is also recommended for people who are weak, have a weak constitution, especially the ones who are pregnant or very old or children. So, and also for people, let's say, who do not have the means of undergoing an entire process of emesis, you can practice something called as Nishtivan. If you're interested, I can send you a recipe, Shrankala, how this is done.
I most certainly am.
Yeah. So these are simple ingredients which you can use, and you can keep them at the back of your mouth, near your throat, and let yourself salivate, let all secretion correct. And you can do this regularly throughout the spring season for 2 months straight. This will help you keep congestions low, ensure, we know immune system, the first set of immune system is in your throat. All these lymph nodes, tonsils around your nose, which actually guard everything that comes in. So when these areas are cleared, congestion free, and active, chances are you may have extremely good immunity for the rest of the year. So Nishtivan is one of the processes which can be replaced for Vamana. For Basti, for enema treatment, if you do not have the time to undergo an extensive, sequence of enema, you can simply do colon cleansing with 30 ml of castor oil, just that. You can buy a colon syringe, use the catheter, rubber catheter, oil the area well, and just 30 ml of castor oil, every weekend, let's say a Saturday, you can do this. The only thing to be careful about after undergoing an enema is once your colon is cleansed, you feel light, and many people feel very hungry once their colon is empty. So to ensure that you're having very light meals throughout the day, in spite of the urges and the cravings that you may get, ensure that your food is very light. Light meaning warm, liquidy, like soupy, and nicely spiced with a little garam masala.
Of course. And at this point, I should call out, it's probably very important to make sure everything in this process is very hygienic. And in case there are any extenuating circumstances, that, you should obviously consult with your physician before an enema, since you're inserting something as castor oil. And to clarify, did you say the castor oil should be room temperature?
Yes, slightly warm, not exactly room temperature. I think room temperature in North America can get quite cold sometimes, but yes, around 35, 37 degrees around your body temperature.
Got it, body temperature.
Yes.
Understood.
Right.
Please go on.
Yes. Now coming to autumn season, when you have to get rid of your excess pitta. Bloodletting is very easy to do. You can simply go and donate blood. So if you suffer from excessive acne, you have rosacea, you have skin irritation, irritability in the body, and you feel that you have more of pitta element, suffering from hyperacidity often, you can simply go and donate blood. Make it a habit of donating blood in, like the end of September, October time, and you'll be set for pitta for the rest of the year. Purgation is also easy to take. You can pick a day. You can have a mild purgative. Mild purgatives could be as simple as, eating a big bowl of raisins, soaked raisins. That can also be a mild purgative. For many, if you're not allergic to milk, taking good amount of milk, let's say about one liter or so, on empty stomach can also work as a mild purgative. Ensure that you're eating very light meal throughout the day once you've undergone a small process of purgation for yourself. For many people, in fact, even honey water works. So just honey, lemon, and water. That's all. It's easy to get. You can just take that in good amounts the first thing in the morning, and the lemon will also help you ease your bowels and remove all the excess bile and balance your pitta. So these are some simple things you can do. And nasyam is simple. Nasyam, just 2 drops of ghee or 2 drops of, let's say, warm coconut oil is all you need in your nose to balance the doshas, have radiant skin, ensure that your hair is growing well, your sense organs are strengthened, your teeth is healthy. So yeah, nasi can be done regularly.
That this is so incredible. And I will throw out that we'll put all of these things, Dr. Zeel, including the recipe that I hope you'll kindly share with me, in the podcast link, on the website, so people can find a way to detoxify their bodies seasonally to stay in tip-top shape. And I do want to pull back to that overall question of a panchakarma under the guided care of an Ayurvedic physician at the right facility. A couple of things, Dr. Zeel, I think a lot of people ask. One is either what diseases are the signs that your body might need a panchakarma, or if you don't, feel a chronic disease, what are the signs that you might actually benefit from a proper panchakarma done at a clinic? Because as I mentioned, a lot of people find it very challenging to go. So it has to rise to a level of importance. But could you share what are the situations when you would say to a patient, hey, it's time for a panchakarma?
Right. Any life-altering problems, meaning you find your day-to-day life troubled with some issues. It could be infertility, because that could nag you. It could be menstrual disorders, if not infertility. If you have, delayed menses or menorrhagia, where you have shorter cycles with excessive bleeding, and it's extremely debilitating for women. For men, if you have sleep problems, if you have anxiety, men do not talk about it, but it troubles them. If you have palpitations, problems which do not make your everyday life comfortable, definitely need to be assessed and treated at a higher level. Medicines may help, but in most cases, they help only throughout the time when you're taking them. Once you stop them, the problem relapses. So all such problems where you fear that the problem may relapse after stopping the medication, I think for all these problems, Panchakarma is the answer. So for problems like eczema, psoriasis, sciatica, chronic pain, you have disc bulge, you've undergone surgery and you've still not found resolution to your problem. So for all these problems, which, like, first, A, they alter your day-to-day life, and B, the problem relapses as soon as you stop the medication. That is the time when I believe everybody should seek out help with the Panchakarma specialist.
Really helpful. Thank you for categorizing that in that fashion. I'm going to almost do 180 and start to talk about basic Ayurveda that we can start with, that feels very easy to plug into our life and integrate. So, Dr. Zeel, in your opinion, for someone who's just getting started with the concepts of Ayurveda and may not have a debilitating concern right off the bat, what are some of your go-to ways or recommendations for people to get integrated, accustomed, and started with Ayurveda in their lives?
Very interesting. Okay. So it's very easy to integrate Ayurveda when you start understanding your body. So Ayurveda begins with knowing you, your constitution, whether you're a Vata, Pitta, Kapha, in which age group are you in? Because depending on your age, your doshas also get imbalanced. If you're very young, you have high kapha. If you're in your middle ages, you have high pitta, and old ages, you have high vata. So first, I think, first and foremost, to inculcate Ayurveda in your life, I think you should start with knowing yourself. See your patterns. Observe, I mean, it may sound gross, but observe your stools. That is something you do every day. Observe your stools. Are they well formed today? You have good agni. Are they not well formed? Are they smelly? So you can start with simple things in your life. Observe your sweat. Observe your urine. Observe your nutrition. Observe your cravings, your sleep cycles. So everything will tell you without having the need of a doctor, of knowing what are your dominant doshas at this point of time. Once you have ascertained that, to give you an example, let's say you've had loose bowels today, and you've had your urination was not normal, it was scalding. Naturally, your pitta is high in the body. So, are you supposed to have more of the vinaigrette dressing on a very sour salad? No. Time to cool down your body. Instead, have, maybe yogurt and oats, which would cool down your body. Or, have cooling herbs like, say, shatavari or fennel, something that would balance your pitta. So I think inculcating Ayurveda in your life begins with knowing yourself, knowing your patterns. The second thing is the circadian rhythm. Now, all of us are born with a natural rhythm, which the modern science also agrees, and Ayurveda has also been talking about it for many years now. All of us, there's a very nice book by Matthew Walker, by the way, which talks beautifully about your natural rhythms and your circadian rhythm. He talks about sleep in terms of circadian rhythm, and I do believe that it's important to function based on your natural rhythm, your circadian rhythm, the things that we discussed in Dinacharya. So we believe that the morning time, the dawn time is a time when you naturally detoxify. So over the entire night, you have been metabolizing the food that you have eaten on the previous day. And this time when you have just woken up is when you release your metabolites out, detoxifying process. So you should pass your bowels in the morning, clear out your urination. You can encourage it with simple herbs, your bowel movement, your urination, and also exercising in the morning to encourage sweating and massaging to clear out your pores. So knowing circadian rhythm and knowing that this is your detoxification time. So cleansing period is what we consider morning to be. So brushing, nasyam, applying colorum to the eye, take scrubbing of the body with udvartana, and taking a bath with lukewarm water is what we recommend in the morning time. The midday and early afternoon is the time when your pitta is high. That is the time you should be eating. You should be. Pitta is also the dosha which helps you, organize your life and helps give you the power to execute it. So this is the time when you should be working on tasks which need prodding, intelligence, organization skills, leadership skills. So between 11 and 2, you're best at this. And also your agni is high, so ensure that you have a good meal during this period. After 2, your vata gets high. This is the time when you can communicate, you can ideate, you can, reach out to people. Basically, a time when you can harmonize your vata. Many people who have disbalanced vata may also feel that they feel tired after 4 o'clock. The energy, they feel a sudden energy slump and they resort to, let's say, some sort of stimulants, maybe caffeine or something, to help them, rev up their systems. But Ayurveda recommends if you have a balanced vata, you may not need those kinds of stimulants. So balancing, I'll come to that, how to balance vata. So this period from 3 to 7 p.m. Okay, so in India, the sun sets at about 6, between 6 and 7. But in North America, you can divide the day likewise into three, one third each, comprising first kapha, second pitta, and third vata. So the last period of the day is the vata kala. Ayurveda believes that you should have your last meal during this period because after sunset, your kapha is on high again. Kapha is a congestive dosha. So when you have a heavy meal, especially after sunset, you are inviting metabolic problems, especially if you are kapha dominant and already suffer from metabolic problems. So kapha time, and then the next period is pitta again. Ayurveda strongly recommends that you do not stay awake at this time. Remember, the Pitta Kala in the morning time between, let's say, 11 a.m. to 2 p.m.
And
is
Dr.
when,
Zeel, just to clarify, we are thinking the Pitta Kala at night is sort of the 1 to 5 a.m. window. Is that accurate?
more from 11 p.m. to
3 a.m.
Yeah, yes.
Okay.
Yeah.
Understood.
Yeah.
Okay.
Right. So if the sun sets at 6 o'clock, that's the ideal scenario. I mean, I'm dividing the day into 12 and 12.
That makes sense. I suppose in North America, maybe in the summer, some of those hours get pushed out a little bit. Like it's July right now, and I think sunset's around 8 p.m. on the East Coast. So I suppose that pushes the hours a little bit longer out.
Right. So you can take the hours of your night and just divide them into 3 parts equally. So you know when is it time. So considering that it is a 12-hour day, so believe it, between 11 p.m. to 2 a.m. is when your pitta metabolic fire is high. In the morning, your Jaఠragni is high, the gross fire, which demands food. And at the night, this food gets assimilated in your body. So staying awake during this period and eating during this period is definitely calling for diseases, especially of the metabolic kind and all kinds of diseases, because Ayurveda believes that this is the time the food that you have eaten gets assimilated, gets converted into a part of you. And when this gets disturbed, all the three doshas may get disharmonized. So yes, this Pitta Kal, for everyone, it is recommended that people, if you have a job during this period and find it difficult to sleep, try and refrain from eating anything or even drinking anything. Fast during this period. You can eat before or maybe afterwards, but during this period, rest your system so that the food that you've eaten get assimilated well. And sleep is definitely recommended, but I understand people may have other commitments, but try and sleep during this Pitta Kala. The end is Vata Kala again. Many people, especially people who have sleep disorders, do complain that they suddenly wake up at the start or the end of the night. Again, when their vata is disbalanced, they feel that it overfires. It makes you since vata is motility, moving, it excites you and perhaps does not let you sleep sound during this.
And again, just to calibrate, it's that 2 to 3 a.m. window at night that it starts.
Yes, till the sunrise is when the
that makes a lot of sense. I know that a lot of people that don't sleep well, including my husband, do get that midnight awakening at about 2 or 3 and have a lot of difficulty going back to bed.
Yeah. Well, there's a very simple solution for it, Shrankala. He needs to balance his vata. What you see why it is getting deranged. We can discuss that if needed. Why you would have the kind of dosha getting deranged, and then the symptoms, of course. Yes. So vata is deranged for many people, and that is when you wake up to start during this vata kala. But no problem. There are medicines to cure that, so definitely we can.
And coming back to this, Dr. Zeel, what, in this Vata Kala period at night, I do want to miss the recommendations that you have. What are the do's and don'ts in this period?
Right. So even let's say even if you wake up with a start during this period, and many people find themselves peckish, like we discussed, since this is Vata, it just burns up your energy and you feel like eating something. Also, food makes you feel nice and you think they put you back to sleep, but it may not. Do not put anything in your body right now. What I would recommend during this period is medicines apart, what you can do is simply take some lotion or oil and massage your feet, massage your ears, or simply massage your head, and try and get comfortable. Practice deep breathing, and chances are you may fall asleep again. You're simply calming your vata with these simple techniques. And yes, waking up at the end of vata kala, meaning right before dawn, is an excellent time, especially if you suffer from vata disorder. Try and wake up just before dawn. You can, calibrate it whenever your dawn time is based on your geography. And practicing pranayam and yogasana during this time can greatly harmonize your vata problems, especially the waking up part or the slump of energy that you feel at the end of the afternoon. Both can be cured when you wake up just before dusk and do simple vata balancing exercises like massaging, yoga, pranayam, simple techniques apart from medicines. Yeah. So introducing Ayurveda. A, we discussed knowing your prakriti. B, knowing your natural rhythm. And C, seasonal rhythm also. So you have an internal clock, but the earth has its own clock. Apart from the diurnal rhythms where you have day and night, you also have seasonal rhythms as we know of. So trying to harmonize your body around these seasons is also important. Like trying to lose weight during this season is not a good idea because it may derange your vata greatly. You may have aches, pains, troubles, all kinds of vata related problems if you try
Sorry,
to
Dr.
go on
Zeel, to clarify, when you say this season, you mean which season?
this season now.
So basically, since we're in summer, I should calibrate because the podcast might come out later.
Okay. Summer
We're
season.
in the summer season. Got it.
So in the summer season, your vata is on high, and going on a calorie deficit diet or straining your body during this season can cause injuries, troubles, pains, pulls, herniations, all sorts of troubles. So it's recommended that you keep your vata low, exercise in moderation, and do not attempt a very drastic diet or fasting during this season.
You can learn more about Dr. Zeel by visiting her website at drzeel.com. That is DRZEEL.com. As we conclude this episode, we invite you to delve deeper into the world of Ayurveda with UMA. Please subscribe to the UMA Ayurveda Podcast to continue this transformative journey with our series of conversations that we hope you'll find enlightening. Visit umaoils.com, that is UMAOILS.com, for an even more immersive experience, exploring not only our luxury Ayurveda products, but also an array of inspired wellness insight and lifestyle tips.